Many of you also have concerns about the virus and have been reaching out to us. Our Jeff Semple went to the experts to get some answers. So Jeff, what's the latest on how long it can live on surfaces?
Well, Robin, health experts say that COVID-19 isn't airborne, but is instead spread through droplets that are created when someone coughs or sneezes and are often then spread on different surfaces. And that's prompting a lot of viewers to ask this.
Hi, my name is Lil Ronalds and I'm calling from Vancouver, British Columbia. And my question is, how long does the COVID-19 virus last on different types of surfaces?
And on different surfaces, it can last up to a couple of days.
A new report found that the virus can survive on cardboard for up to 24 hours and on a plastic surface for 2 to 3 days, meaning someone could cough on this bench and a couple of days later someone comes by, touches the bench, rubs their eye, and gets infected. The virus is less likely to survive on porous materials, such as clothing or pet fur.
Depends on the surface, the temperature, and the humidity.
Hi, my name is Sam. Me and my wife live in Vancouver, BC, and we are almost 20 weeks pregnant. And I was wondering if pregnant women are in fact more susceptible.
Fortunately, the little information we do have would suggest that pregnant women are not at an increased risk of getting this. And there's even doubt as to whether the virus can pass through the placenta and infect the fetus.
On the streets of Toronto these days, it's not uncommon to see people walking around wearing one of these, a surgical mask, or even the professional grade N95 respirator.
My name is Barbara. I live in Keswick, Ontario. I was wondering, would masks help in this case?
Experts say there's no evidence to support wearing masks, and users are often more likely to touch their face.
So the only reason to wear a mask is if you are sick.
He says the best advice is to avoid gatherings, even in small numbers. But one viewer wrote to say that it seems there are a number of people choosing to ignore this self-isolation mandate. The St. Patrick's Day celebrations at Queen's University went ahead despite warnings from officials.
So I have a compromised immune system, but I'm still only 21, but I'm not even worried.
If you get this disease and you have the sniffles and a fever, it doesn't mean that the person you pass it to, who could be your parent or someone else you care about, won't have completely different symptoms in them. They could die because you passed it to them.
If you do the math, the result is grisly. Conservative estimates suggest that around a third of Canadians will catch COVID-19 and that 1% of those will die, meaning more than 100,000 Canadians are expected to be killed by the coronavirus this year. Robin?
Thanks for that information, Jeff.